sickle cell disease is a broad classification that usually consists of, we have number one, we have the sickle cell trait, and we have the sickle cell anemia. Now, among these two types of sickle cell disease, this one is more detrimental than the sickle cell trait. So sickle cell disease generally, they are autosomal recessive disorders that usually affect people around the world. So most times it's usually more dangerous in Africa or sub-Saharan Africa because of the factors. In Nigeria, sickle cell disease is more common in the north, especially Kano. So there are some causes. That is the causes of sickle cell. So we have what we call the sickle cell habitus. The sickle cell habitus is what you see from a person's physical appearance that will tell you that, okay, this person has sickle cell. So first of all, for the sickle cell habitus, number one is there will be swelling of the person's forehead. So if you see anybody with frontal head bursting, it's called bursting. Then two, there will be yellowish discoloration of the eyes, which is known as jaundice. Then three, there will be abdominal swelling or abdominal protuberance. Then the last but not the least, there will be thinning of the extremities. That is extremities means the hands and the legs. So thinning of the limbs. That is the hands. The limbs consist of the hands and the legs. So now there are some precipitants that usually precipitate the disease. That is the sickle cell anemia, which is the more dangerous one. So when the patient is precipitant, so number one, when the patient is dehydrated, it will precipitate symptoms of the crisis. So if you know any sickle cell patient, always make sure that they receive enough fluid and they should not be dehydrated. So the number two cause is hypoxia. Hypoxia means low oxygen. So if you are staying in a story building, and you have a sickle cell patient in your house, always make sure that they stay at the ground floor. Because hypoxia, the higher you go, the more the low oxygen tension. So when the person stays above, there will be low oxygen tension and to precipitate the crisis. So we also have things like emotional stress. So we should try as much as possible to prevent provoking people with sickle cell, because emotional stress can actually tilt them to crisis. Then we have exercise, severe exercise. So severe exercise is part of the causes